Hello, welcome to Hurst. I'm so glad you're joining me here at lunch today. Listen, we are going to talk about some NCLEX challenge questions, okay? We're going to give you a couple of questions and I want you to shoot me the answers. Before we do that, my name is Robin. I've been working with Hurst Review for the past 9 years as a part-time instructor, and I help out in the marketing department. I love working with nursing students, so I'm glad to get to do this today. I have been nursing for 29 years, so I just love working with nursing students. But before we do our questions, I want to talk to you about the Next Gen NCLEX. Hey, it is here, right? NGN. You will have 5 hours to complete your exam, and you will have a minimum of 85 questions and a maximum of 150 questions. Now, you want to know how you can pass the very first time? Let me tell you just a little bit about Hurst Review. We are a different company. What do I mean by that? Well, our founder, Marlene Hurst, she is a nurse. Throughout our company, you will find a nurse working in almost every department. So you see, we are a company that was built by nurses for nurses. We know exactly what you're going through. Wherever you are in your nursing school career, guess what? We have all been there. 9 out of 10 students tell us they would recommend Hurst to their friends. They love what we do here at Hurst and they have great success and they like to share that. We love that number. We have a 98% plus first-time pass rate. If you do exactly what we tell you to do and you follow the checklist for success, you will enter that testing center with a 98% plus first try pass rate. Now, isn't that great news? For over 30 years, Hurst Review has been helping nursing students just like you pass the very first time. Let's talk about this test just for a minute. If you do not pass, guess what? Your odds of passing decrease. The NCSBN tells us it decreases to around 50%. Now, you don't want to be put in that category. Let's pass it the very first time. This test is a safety test. They need to know that you can keep everyone safe and alive. That is the name of the game with the NCLEX. You got to be able to keep yourself safe, your coworkers, and your clients before you get that license in your hand. Now, this test is not like your nursing school test. It is different, but Hurst Review will prepare you for that. The next slide I want to show you is a picture out of one of the pages of our workbook. When you sign up for a Hurst Review, everyone gets this workbook. Students love it. The only way to get it, though, is to sign up for a review. We do not sell them separately. It has fill in the blanks. It has lab values. Well, the fill in the blanks is going to help you stay focused with your instructor, right? And then it has lab values, tips and strategies, diagrams and pictures. And all of that is integrated into whatever topic your instructor is talking about at that moment in time. Well, y'all, that helps you get that content into your long-term memory, right? And it makes it easy to understand. Listen, we have everything you need to pass the very first time. Not just content, we are a comprehensive review. We have test questions, and we have everything you need. We have readiness exams, everything you need to pass the very first time. Okay, so we have a select all that apply question. I'm going to put this up. And I want you to answer this question, and I will be back to talk to you. Now, first of all, select all that apply. Remember, you do get partial credit on the new NGN. Make sure you understand that rule. Select all that apply. You could have up to 10 options, and guess what? There's not a limit on how many could be correct. It could be one, or y'all, it could be all of them. We want you to read that question and then approach each one of those options as a true-false option. And then you choose all of the true options as your correct answer. Okay, I will be right back. Chat your answers. Okay, let's read this question together. To reduce the risk of developing a complication following a balloon angioplasty, the nurse should implement which measure? Select all that apply. Okay, you were the nurse, and the NCLEX is saying, hey, you brand new nurse, do you know what a balloon angioplasty is? Well, do you? What is that? Well, that's when they take a balloon or a stent and they place it where? In the patient's artery, right? In the client's artery. But why do they do that? What is the purpose? What's the purpose of a balloon angioplasty? What do you think? Well, you're thinking, well, they want to open up the artery. That's true, but why are they wanting to do that? To do what? Enhance perfusion, right? That's right. They want to enhance perfusion. So those are the first things that we need to think about. What is a balloon angioplasty and what is the purpose? We want to enhance perfusion. Now, the next thing I want you to do is assume the worst. What is some of the worst things that could happen to your client during this procedure or after this procedure? Think about things like, what about bleeding and hemorrhage? Yes, bleeding. Yes, could they bleed after this? Absolutely. What about a lethal arrhythmia, a stroke, a MI? Could they throw a clot? Yes. I want you to assume the worst, okay, before you go to select your answer. So here we go. What are some complications that could kill the client if you assume the worst? Okay, you're going to think about things that could kill your client or cause major harm. Look at number one. Is this a measure that we are going to implement? Monitor the cardiac rhythm. Absolutely yes. The primary healthcare provider should be notified of any rhythm change or report. What if they start reporting of chest pain or some discomfort? This could be signs of reocclusion. Look at number two, true or false. Assess the puncture site every 8 hours. Well, I know that we are going to assess that puncture site, but I think it's going to be a little more frequent than 8 hours, right? So part of that's true, but every 8 hours, y'all, that makes that one false. Although your policies may differ wherever you work, but we are going to be looking at that insertion site. It is usually done every 15 minutes for the first hour and then about every 30 minutes for an hour if you're not having any complications. And then you will reduce it to about every 4 hours. Now, again, more frequent monitoring may be required, just depends on if you're having any complications. What are we looking for? Bleeding, hematoma formation, right? So number two is false. Number three, measure urinary output hourly. Is that true or is that false? That one is going to be true. Y'all, a decreased urinary output could be due to poor renal perfusion, right? Yes, which can result from decreased cardiac output and shock, okay? Frequent vital signs, urinary output measurements, those will be needed. Look at number four, prevent flexion of the affected leg. That one is going to be true as well. Flexion peak, that should be avoided at the catheter access site. Why? Well, we want to allow time for that clot to stabilize, don't we? We need to reduce the risk of bleeding and the formation of a hematoma. Look at number five, avoid lifting buttocks up off the bed. Well, that's kind of the same thing as number four. That one's going to be true. We want to avoid lifting the buttocks off the bed because this increases pressure at that insertion site, right? Which increases the risk of hematoma formation and bleeding. Remember, we want that clot to stabilize. So your correct options are number one, number three, four, and number five. All right, number two, question number two, select all that apply. I will be right back. All right. Which signs and symptoms would indicate to you, the nurse, that the client is having an anaphylactic response after receiving penicillin? Select all that apply. Okay, now, an anaphylactic response. What is that, y'all? These are symptoms that what? They progress, don't they? Yes, you have got to assume the worst, right? Assume the worst. Anaphylaxis, that is a medical emergency. That is a type of shock. We need to pick up on signs and symptoms early right here so we can help our client, okay? So let's look at number 1. Reports a scratchy throat. Is that one true or is that false? What do you think? That one is true. Hey, swelling of the face, the mouth, the throat, and a scratchy throat, those are all indicative of an inflammatory response that could obstruct the airway. So absolutely, number 1 is true. Look at number 2, a faint expiratory wheeze on auscultation. Hey, what do you think about that? Is an expiratory wheeze, is that normal anytime? No. So that one is true. Wheezes, stridor, those are all indicators of breathing difficulties, and that is seen with anaphylaxis, okay? Number 3, the client states, I feel like something is wrong. True or false? Hey, that one is true as well. Listen, a sense of something bad that is happening should serve as a warning sign to us, the nurses, that something bad is really going on. Listen, I want you to suspect an anaphylactic response. We have a rule right here. If you have a client who is restless or they are anxious, they just can't get settled down, I want you to think hypoxia first. So that should be a concern. Number 4, a bounding radial pulse at 100 per minute. That one's false. The pulse rate would be increased, but it's not going to be a bounding radial pulse, not if they're in shock. It's going to be a weak, thready pulse, right? That's right. Now look at number 5, blood pressure 100/70. Hey, is that blood pressure below 90 systolic? That's when we start worrying. This could be a normal blood pressure. That is a normal blood pressure for a lot of people. They did not give us a baseline to compare it to, so we have to go with a normal blood pressure, right? That's right. So listen, even though the blood pressure reading does not tell you if their perfusion is adequate, once the blood pressure, if it starts to decrease, other symptoms may appear. They may begin getting dizzy, right? Blurred vision. What about loss of bladder and bowel? Okay. Again, we don't have anything to compare that to. Do not panic until it gets to below 90/60, because we want to perfuse those vital organs. So your correct options are number 1, 2, and number 3. So you're a brand new nurse. Let's talk about that, okay? Let's talk about that before we go to our final question. When I say I want you to assume the worst and I want you to think NCLEX, what does that mean? Well, I want you on the NCLEX, when you have a question that pops up, you have got to assume the worst thing is happening with your client, okay? You will never go wrong if you assume the worst. No matter how minor it is, assume the worst. Now, fix the problem if you can. If they give you an option where you can fix the problem, that's what they want you to do. If it is in your scope of practice, you have got to help that client, okay? Now, safety, safety, safety. Y'all, it is a safety test designed to protect the public from unsafe nurses. So you have got to be able to keep the client safe and alive, okay? We don't want you over here doing an assessment when you should be doing an intervention, okay? You have always got to think safety on the NCLEX. Okay, we have another select all that apply question. Chat your answers. I will be right back. All right. What should the nurse include in the post-op care of a client following the removal of the posterior pituitary gland? Select all that apply. All right, so here we go. Let's talk about this. The pituitary gland. Where's the pituitary gland? Where is that, y'all? Where is it located? Somewhere right here between the eyes, right? Yes. What is do you remember which hormone is produced in the pituitary? Anti-diuretic hormone, your ADH? Yes. So removal of the pituitary gland can lead to diabetes insipidus, DI. Do you remember that? As a result of the reduced production of your ADH? Okay, so let's look and see what we should do right here with this client. Do you think that we should monitor their I&O? Absolutely yes, right? Look, the removal of the pituitary gland can lead to diabetes insipidus, like we just said, as a result of that decreased production of your anti-diuretic hormone. Y'all, we must monitor that I&O closely, and we need to watch for an increase in output, right? Yes, which would indicate diuresis as a part of diabetes insipidus. Look at number 2. Would you restrict the fluids to no more than 1,500 milliliters a day? Would you do that? No. If the client is lacking their ADH, that anti-diuretic hormone, the client may start losing large amounts of fluid volume. Therefore, the fluid volume would need to be increased, not decreased. We need to avoid dehydration and, most importantly, shock. Look at number 3. Are you going to weigh them daily? That one is true. Daily weights are an important part of monitoring a client's fluid status, right? What about monitoring the urine-specific gravity? That one is true. That one's true as well. Listen, that is another good way of assessing the fluid status, because as the urine output increases, their urine is going to become more dilute, right? That's right, which is going to result in a lower urine-specific gravity. Look at number 5, assess the level of consciousness. What do you think about that one? True, yes. If the client's serum volume, if their volume is decreasing from excessive diuresis, the client could go into shock. Y'all, we as nurses should monitor for early signs of changes in the level of consciousness. We need to really monitor that. And then number 6, instruct the client to avoid blowing the nose forcefully. True, yes. To avoid disrupting the surgical site, okay? They do not need to blow their nose forcefully for at least 1 week post-op. Remember, they're going up through the nose to get to the pituitary. So your correct options, look at there, 1, 3, 4, 5, and number 6. All right, now, hey, we teach a lot. We want you to know that content without a doubt and without hesitation, okay? But that is not all that we teach you at Hurst Review. We teach you to critically think. We get you to using good clinical judgment so that you can apply the knowledge that you do have to a lot of different questions, okay? All right, now, at Hurst Review, I'm going to go over some options that we have for you. We'll switch on over to that Hurst Now and Hurst InStream. Thomas, Hurst Now, and Hurst InStream, both of these are 30 hours of that must-know core content, okay? Now, the difference is the delivery method and, of course, the price. Now, the delivery method, Hurst Now, is a guided self-paced video. If you do not need structure and you can do that on your own, this one is for you. Hurst InStream is a live review that comes to you in a streaming format. It is taught by Hurst's expert faculty, and we have convenient schedules. You will be able to interact with your instructor, and you will be able to ask a question and get that answer back in real time. A bonus with the Hurst InStream is that once you have completed that, once you do everything in your account like we ask you to, you will have an access to 14 days to go back and rewatch that live review as many times as you want to in that 14-day period. Students love that Hurst InStream. With both of those, you get that fabulous workbook, okay? And you will get faculty support from Hurst Review. Elevate, let me tell you about Elevate. That is a companion course for any of our reviews, RN, PN. It dramatically decreases test anxiety and improves your clinical judgment skills. It has extra work for you to do, but it guides you through the study of Hurst with structured modules, video lectures, high-level quizzes, and a lot of NCLEX study tips. We call this your study buddy. Students wanted something to guide them once they completed their Hurst review, and that's how Elevate was created. So if you're interested in Elevate, check out our website. Make sure that you're checking out our website for everything. First, I want to show you this. PayPal, Google Pay, and Apple Pay is coming soon. But PayPal and Google, those are options that you can pay for your course. Now, NCLEX free events, Hurst. If you are missing out on any of these, you don't need to be. There's over 11 different topics, mini reviews, NCLEX challenge questions, NCLEX 101, that core information that we want you all to know before you go sit for your exam. Check out hurstreview.com/free-events for more information. Now, make sure you are following Hurst Review on all of social media outlets. Instagram, Facebook, TikTok, X. Listen, my friend Ashley, she loves to keep you up to date on what's going on in Hurst and the NCLEX world. Also, she and her friend Sarah, they have some amazing podcasts, and you do not want to miss any of those. Free 2025, that gets you $40 off of InStream, $25 off of Hurst Now, and Hurst Now Plus. That's the one that includes Elevate. But don't forget, you can purchase Elevate with any of our reviews. Acid Base Essentials, y'all, that is a 4-part series that you will find on our website. If you struggle with acid base, this will make it so easy for you. Check out hurstreview.com. There's our home office phone number. You can always call and talk to someone. There is always someone here that will help you with whatever problem or question you have. Free 2025, okay? All right, invite your friends. They may not know about the free events. Everyone needs to know about Hurst Review's free events, okay? Okay, so free 2025, we hope to see you again real soon. I want you to take care, log in and look at everything on our website, check out all the free events, and we hope that you will come back and join us. Take care. Bye for now.